Time now for medical rounds. 1 week ago today, the state reopened and lifted most COVID-19 restrictions. Today, we're talking about the impact that these changes have on those who are suffering from mental illness. And joining us now to talk more about that is Dr. David Tolan. He is the director of Anxiety Disorder Center and Center for Cognitive Behavioral Therapy at the Institute of Living. Thanks for being with us, Doctor.
Thanks for having me.
You know, we've gotten to talk to you so many times about different issues, but do you think that COVID has really taken a toll on people who are suffering with mental illness in general?
You know, I think what we see across the population is that anxiety is up and lots of people are experiencing anxiety related to COVID, but it does seem to be even worse for people that already had some anxiety or depression related issues. It also seems to be worse for historically marginalized populations. Those people who get neglected by society seem to do worse with the COVID pandemic in both physical and mental health ways.
Sure. So as we get back to work and things are reopening, the new normal may not be easy. Who's struggling?
Well, I think lots of people are struggling with anxiety about not being sure whether it's okay to go back and not being sure whether things are going to get worse. And I think it's important for people to recognize that this situation is both uncertain and temporary, and that it's okay not to feel okay about it, that we don't have to feel better all at once. It's okay to seek help and support if you need to.
Yeah, so what treatments are available for those who are struggling with anxiety? And, you know, hopefully you can give people some hope.
Sure. Well, and the nice thing is that anxiety tends to respond really well to treatment. And the number one treatment that's out there is called cognitive behavioral therapy. And this is something that you can do with a professional, but there are also things that you can do just on your own as a way of trying to manage anxiety. And we know that the vast majority of people who receive this kind of counseling do in fact get significantly better.
So what's your advice to those who are seeing this new normal with more anxiety?
I would say, first, consider this a time to reflect on who you want to be during this time and focus on what's within your control. You can't control the entire spread of COVID, but you can control whether you wear a mask, you can control whether you physically distance, you can control whether you're vaccinated. And although it's good to be informed, it's also a really good idea to take breaks from time to time from conversations or news or information related to COVID-19. Don't overdose on the information.
Okay. For more information and to get some help, folks can visit instituteofliving.org. Dr. David Tolan, thank you so much for being with us.